what made you specialize in neurology and in particular MS?
Yeah, so neurology is a booming field. And so there have been, the past couple decades especially, so much research going into understanding why disease occurs in neurology and all the subspecialties of neurology and what to do about it. So as physicians, we are considered lifelong learners. And so I guess I was attracted to the idea that I would never get bored.
Yeah.
Um, in particular, so I specialize in multiple sclerosis and neuroimmunology. And what attracted me to that field, not only the research, but also the fact that you establish lifelong relationships with your patients and that you can't just know your neurology training, you have to remember all of your medical training because it is such a complex disease.
That's neat. And for those of you who don't have the pleasure of working with the doctor, she's fantastic and she is very empathetic and very supportive of her patients. And I will tell you that can be rare to find these days. So thank you for your specialty in MS.
Thank you, Nancy.
Can you tell me what are the symptoms of MS and how does the disease progress?
Yeah, so MS has a highly variable presentation. So it can range from very mild disease with virtually no symptoms to, on the other end of the spectrum, a very staggeringly disabling disease, which can affect the entire body and the mind. And so on one end of the spectrum, you can have somebody who's 22 and they can barely get across the room without their walker. And on the other end of the spectrum, you can have somebody who's in their 80s and they're playing pickleball and they've never been on MS treatment in their entire life. So it's highly variable. The disease course, as you can imagine, is just as variable. And that's why it's such a difficult disease to wrap your head around and to deal with on a day-to-day basis.
Doctor, I'm curious why there's a variability, because as you said, you'll see people who are 23 and tremendously disabled, and you'll see 80-year-olds playing pickleball. Why is this variability in patients? What's the medical cause?
Yeah, so that's a great question. And that's one that we are trying to strive to answer worldwide. And so when I said that the field was booming with research, that is one of the questions that we are really aiming to find the answer to. I mean, we know in general it has to do with the physiology of the disease, the neuroimmunology behind it. Genetic factors may come into play, risk factors such as smoking and diet and activity level, they may all interplay. But behind the scenes, what is the main reason, the core of it for why people experience some aggressive disease and other people don't? We don't have the answer to that yet. So stay tuned. Hopefully we'll have an answer for you in a few years down the road.
So how is MS diagnosed? What are you looking for clinically and on diagnostic studies to arrive at the diagnosis?
Yeah, so MS is a very difficult disease to diagnose. So some of the leading sources actually think that there's up to 20% of people who have been diagnosed with MS don't actually have the disease. And part of the reason for that is because we do not have what we call in medicine a gold standard test.
Right.
So a gold standard test where you can get that one thing done and it can tell you with pretty good accuracy whether disease is present or not. So really the diagnosis comes from putting the pieces of the puzzle together, the history and the symptoms, the neurological exam findings, the laboratory data, the MRI data, and trying your best using your expertise, your experience, and pattern recognition to recognize that the disease is present. And so you may get a couple different opinions if you go to a couple different specialists as to whether or not you actually have the diagnosis. And we run into that problem a lot.